Hello everybody, I am Dr. Valeria Soltanik, and today, very specially, I want to go over cavities and what happens when they are very deep. That's what a lot of patients tell me. It's just a cavity, I'm gonna let it be until the next appointment, or it's just a cavity, it's okay, it doesn't hurt. But let's look a little bit at this model here. Here we have a normal tooth without anything on it, healthy. And here we have the model of a decayed tooth. So here you can see in 3 areas this tooth is decayed. It's decayed on the occlusal biting area. We also have decay on the side. And here we have more close to the root or where the tooth meets the gum area. So these 3 areas, decay, cavity as you may call, these are dangerous if we let them be, if we do not take care of them. So here, look at the healthy area, hard, so nothing. That's what we check. Another thing, when we do the exam on the patient and we go with the Explorer, this for purposes of the video, it's a little thicker so I can show, but we go and we check if we catch on any area of the tooth, on the occlusal area. When it comes to these side cavities, we will observe them on a radiograph. So here on this occlusal area, on the biting area, the cavity is deep. Let's try to get rid of all this modeling purposes here. As you can see, when we fix a cavity, we'll be doing the same thing. We will be digging with the drill. Here I just want to show you how deep. So once, remember another video that I showed, once the cavity crosses the enamel, it spreads, it goes much wider inside. So let's remove all this here. When you just think it's just a cavity, okay. Let's remove all the decay. The decay basically is the bacteria that release acids and destroy. They have the ability to destroy the enamel and the dentin, which is the layer under the enamel. So here we're removing everything, and I'm gonna go sideways. You can see it goes much deeper. So let's remove here, and let's turn this around. It continues. Remember, look how once the cavity crosses the enamel, which is all this white and strong area, it's like an inverted triangle. All the decay, the bacteria have destroyed this. Look, all down in an inverted triangle area. Fashion, I mean. So let's remove all that. And this is the dentin. It is softer than the enamel. That's why it explodes like this. Much bigger. You might see a little dot on the top, but beware, it can be something much bigger inside. Not always they hurt when they're very big. I've seen people with even abscesses that have no pain. So in this case, it has reached very close to the nerve. So this one, it is close to the nerve, but we might be able to just fix the cavity, okay? Now, let's turn to the one that was coming through the gum area, close to the gum area on the side of the tooth. Look how deep it goes. This one, because the amount of enamel on this area of the tooth is much smaller than all this thick enamel area, this one has already cut through the dentin, which is the softer area inside the tooth, and it has already attacked the nerve area. and boom, this tooth needs a root canal if the cavity has attacks through this area here. So in this case, we'll have to do a root canal. So this type of attack of a cavity through here. Now, this one is questionable. We will fix it, but it might require further treatment later on because it is too close to the nerve area. Now, this one here, it's a flossing cavity on the side of a tooth. It is not as big. It is close to dentin, but it hasn't crossed the in between the enamel and the dentin area. So this one can be easily fixed with bonding. We do it with a composite filling, tooth colored filling. So in this case, we can attack it quickly and fix it. So here we have 3 types of cavities, although in different positions, different depths. So here we need to do a root canal. Here it's a little questionable because it's very close to the nerve. We will fix all this here, clean it all, maybe put a protecting layer and then the filling. And in this case, it's just a filling. So do not, the message I want to give you here, do not allow a cavity to just sit there and destroy your tooth, because you might be seeing just a tiny drop, a tiny dot, but then at the end, inside, it is destroying your tooth and you might lose that tooth. So remember, very important to get an exam, get everything checked, and get it fixed before it is too late. Thank you so much, everybody. I am Dr. Valeria Soltanik, and thank you for watching the videos. Do not forget to subscribe to my channel, and do not forget to write any comments or questions you have about future topics. Thank you so much for watching the videos.